Can the pharmacy to the world be trusted? With dozens of children dead in the Gambia and Uzbekistan, the world's biggest generic drug maker is under scrutiny. How did regulators fail to stop Indian pharmaceuticals from exporting toxic medications? And could it happen again? I'm Andrea Sankey, and today's newsmaker is India's pharmaceuticals. It is tragically not the first time innocent children in developing countries have died taking simple, over-the-counter medication. Most recently, at least 19 children in Uzbekistan were killed after consuming Indian-made cough syrup containing toxic levels of diethylene and ethylene glycol. That's a compound used to make antifreeze or engine coolant. And just a few months earlier, that same type of contamination killed at least 70 children in the Gambia. Investigations are underway into how these toxic medications were allowed into the marketplace and to determine where regulation failed. Here's a look.
At least 19 children under the age of 6 died from kidney failure in Uzbekistan last week after they consumed cough syrup made in India. According to the Uzbek Health Ministry, the medicine, which is designed to be safe for children, was contaminated with a toxic substance. Marian Biotech, the company behind it, halted manufacturing and said it would investigate the claims.
We regret the deaths. The government is conducting an inquiry to find the reason behind the deaths. The matter is under investigation. We will get to know the exact details after the report comes.
Last year, another Indian pharmaceutical company took heat over medicines sold in the Gambia, which were linked to the deaths of 70 children. Wuri Belokita's 2-year-old daughter, Fatumata, developed a fever. He rushed her to the hospital where she was diagnosed with malaria and sent home with a prescription for a paracetamol syrup. Less than a week later, she was dead.
The child, nothing came down her throat. She wasn't eating, couldn't eat because of the pain. There was even some blood coming out of her nose and her mouth.
The World Health Organization said it found an unacceptable amount of diethylene glycol and ethylene glycol in 4 Indian-made syrups. Ethylene glycol is a toxic substance commonly found in motor vehicle, antifreeze and refrigeration units. The WHO raised a global alert over the medicines.
WHO recommends all countries detect and remove these products from circulation to prevent further harm to patients.
The Gambian National Assembly has concluded that the cough syrups made by Indian pharma firm Maiden Pharmaceuticals were linked to a spate of cases of kidney failure. And launched a door-to-door campaign to collect the potentially contaminated medication. India, which produces a third of the world's medicines, has rejected the WHO report and denies the cough syrups were contaminated.
Well, joining me now to look at the Gambia's investigation into the deaths of these children is Dr. Peter Adebayo Adewuyi. He is an epidemiologist and a member of the Gambian government's incidence management system for acute kidney injuries. He joins us now from Ibadan, Nigeria. Doctor, thank you so much for being with us. You were also a member of the emergency response team that the Gambian government set up to deal with the deaths of these children. Tell us, when did you first realize that they were not dying from a viral or bacterial disease, but from man-made toxic poisoning?
Nephrologists that alerted the government of the Gambia, the Ministry of Health that works in the teaching hospital, Edward Francis Teaching Hospital, suspected that it could be drug poisoning when she realized that there were a high number of cases of children that were dying from acute kidney injury. So right from the beginning, late July, she's made that suspicion, and the government set up the incident management system of which I'm a part of. And then we started investigating to find out whether it's due to poisoning or is due to E. coli infection or any other infection. So samples of these drugs were sent to Ghana, and within 2 weeks, Ghana gave back the result that there was DEG poisoning, that's diethylene glycol poisoning, in about 4 samples out of, I think, 15 or so that were sent to Ghana. And these were promethazine syrup, cough syrups, and cough mixture, cold and cough mixture syrup. So
Okay.
in order to confirm that, it was sent to Switzerland by WHO. And by October 5, the results were announced, and WHO was able to confirm that high volume of DEG, diethylene glycol, and ethylene glycol is in the drugs that these children were taking and was making them fall sick.
So it was found that all these children's deaths were connected through this common cough syrup or syrups. But when you hear India actually reject your conclusion that these medicines were contaminated at their source in India, as well as India rejecting the WHO report itself, confirming the same, what do you say?
I don't think that can be true, and I don't think that is acceptable. The reason is because the moment in October 5 when we withdrew all the samples and all the drugs, I think about 80,000 of these cough syrups together were imported into the Gambia. We were able to go from house to house, asking and begging people to give us samples or whatever has been consumed, and all of that was collected from all over the country. Since then, we have not had cases.
Okay.
I mean, it's a classical case of John Snow, who is the father of epidemiology. You remove what you think is the source, and then the outbreak stops.
Right. So, I mean, you feel the investigation was thorough on Gambia's behalf, and the WHO confirmed your suspicions. You also noted specifically in some of your comments that Maiden Pharmaceutical, who produced the cough syrup that was sold in Gambia, had a WHO certificate for consumption actually posted on its website that you said was subsequently taken down. I mean, what do you make of that? Do you think they were somehow allowed to post fake certification to give people false confidence?
Well, I cannot speculate, but I actually downloaded that copy of their brochure from their website, and I showed it to members of the IMS. And I think WHO accosted them and immediately was removed. I still have a copy of what was removed. And it was clearly saying that this is WHO certified. Meanwhile, WHO never inspected their units, and WHO has debunked that they never gave them any certification.
Right, but there seems to be denial on their end. But I mean, you definitely believe the responsibility for these deaths falls on the pharmaceutical producer and Indian regulators and quality inspectors there, not on the Gambia. So tell us what actually needs to happen now to prevent this from ever happening again.
Like I was saying about 2 possibilities, either deliberately it was used or there was a problem of quality control. Now, for third world countries, a lot of African countries cannot afford to test every drug that is imported. It's going to cost about $1,500 to test a batch. For example, this batch was produced in 2021, and it was imported into Gambia in June 2022. And we started having cases end of July. We were able to withdraw all the drugs except about 7,000. Till now, we've not been able to get 7,000 bottles. And it's still fearful that some of it might still enter into the system and still cause trouble. We have not had cases since it has been withdrawn, but unfortunately last week we had a case, and we can confirm that that person actually was issued the same promethazine by Maiden product
Okay.
And that baby died,
Dr.
unfortunately.
And it's tragic, and we have to hope it stops from now on. But Dr.
Yeah.
Peter Adebayo, Adewuyi, we have to leave it there. Unfortunately, we're out of time for this segment of the Newsmakers. Thank you so much for being with us. Well, let's broaden out this discussion now and welcome three new panelists. Joining me from Hyderabad is Prashant Reddy. He is the co-author of The Truth Pill, The Myth of Drug Regulation in India. Gobardhan Das joins us from Delhi. He's a molecular medicine professor at Jawaharlal University. And Abantika Ghosh is also in Delhi. She is a health journalist and author at The Print, India. Thanks all so much for being with us. Prashant, I'm going to begin with you because of the title of your book alone. You call it the myth of drug regulation in India. A myth is something that doesn't actually exist. So are you saying there is no actual regulation of an industry that is so crucial, not just to the Indian economy, but to the health of people around the world?
Yes, that's true. There's very little regulation, I would say. Not that there's no regulation. But the fact that, this tragedy that's happened in Gambia, there have been 5 similar incidents in India since the 70s. So this keeps happening in India. And apart from that, we document in our book various other instances of the drug regulatory apparatus completely failing to do its basic job of ensuring quality medicines reach patients in India and around the world.
So why have these failures been allowed to continue?
Well, there are many complicated reasons. I mean, governance in India has been suffering for a long time. So it's not just drug regulation. It's a lot of things in India don't work as they're supposed to. The second most specific point when it comes to the pharma industry is that the pharma industry is very powerful. It's also one of the few manufacturing success stories from India. So the government has a vested interest in ensuring the growth of the pharma industry. It's not very keen on ensuring tougher regulations because the moment you increase regulation, you're likely to slow the growth of the industry. So those are the two basic reasons why drug regulation is very poor in India.
Okay. Gobardhan, are you comfortable with that analysis? And let me ask you as well, in the cases of Uzbekistan and Gambia, India says they've found no evidence of contamination. Do you believe that's possible?
Yes, good evening, and good evening to my fellow panelists, and thank you for having me in your show. There are a couple of things I would like to mention just before I start. I think whatever happened in Gambia, this is an unfortunate incident. This should not have happened, and I sincerely, my sincere condolence and the sympathy goes to the families. Anyway, the two things I would like to mention. Number one, in New India, the led by our honorable Prime Minister, India is now the pharmacy of the world. During the COVID period, we supplied the drugs to 150 countries, and then we supplied the vaccine in 105 countries. And all I'm trying to say, the manufacturing practice, and which follows the highest standard of safety, and indeed that globally been appreciated, and globally we supply drugs. Second thing,
I just want you to clarify, you genuinely believe that India follows the highest standards on the planet when it comes to drug production?
Yes, India follows the highest standard, and that is what this is globally 60% of probably the drugs is made in India. So that is what we practice at the drugs being supplied throughout the world. So that is what we are claiming. Second thing is, see, this kind of incidents, it once in a while it happens. It's not only in India. The people are talking about the Gambia incidents. Do you know this is in 2007, the Panama case, 2008 in adulteration heparin, the 2019, simply my pinky, this happened in Nigeria in 2012, New England Compounding Center In fact, in 1982, there is a simple in Tylenol, there was a contamination of in potassium cyanide. It's not one incidence in India, doesn't mean that our practice is bad or practice is not correct. So basically,
Okay.
India supplies drugs throughout the world, and India practices the highest possible safety measures.
You know what, Prashant, quickly, I'll let you respond to that. It's hard to reconcile how the two of you have such completely different opinions on the standards that are enforced on this crucial industry.
Well, I mean, I've based my comments on research that I've done. So coincidentally, when our book was published in October, when it came out, that was the same time this tragedy in Gambia happened. And by a sheer coincidence, the prologue of our book starts with documenting 5 incidents of DEG poisoning. That is the same kind of poisoning that took place in Gambia and Uzbekistan. And this repeatedly happens in India. This doesn't happen in countries on a repeated basis. I will give, I will concede to Professor Das that there can be the occasional slip up. But we've had 5 such incidents. In 1998, 33 children died just on the outskirts of Delhi. January 2020, 12 children died from the North Indian state of Jammu and Kashmir due to DEG poisoning. And now we've had 2 incidents which have been linked to Indian companies.
Okay.
And the reason that I'm confident in what I say is because I've studied how the regulatory system works at every level. There is no transparency. There is a reluctance to prosecute companies. And even when cases are prosecuted, we have noted with how prosecutions are actually done in court, where the punishments are very, very lenient. So I based my comments on my research.
Let me get Abantika into the discussion here. Abantika, I mean, it begs the question now, I mean, listening to these 2 opinions, whether or not anything or anyone will actually be held accountable, because it also goes to an issue here that the WHO has confirmed, for example, the Gambia's investigation, saying that this was these toxins that came from the source in India through these cough syrups. And now India is saying, making the point that it thinks the WHO is actually biased, that the WHO somehow favors Chinese producers, and it's kind of a move against India. Is there an issue here as well of politicizing this to try to avoid responsibility?
Totally. Also, we're talking still about Gambia, but since then, we've actually had another instance in Uzbekistan, which is very similar. And
Yes, that was included in our report at the top, yeah.
Yes, the production has been stopped in the Mariam biotech plant. Also, this morning, actually, I had occasion to be in the ministry, and I had asked the minister about what is happening. So what I'm told is that Mariam has basically said that, the batch that went to Uzbekistan, that is from April 2021, and you can check in all the countries that it has gone to, that nothing of this sort has happened. Also, another point that was made is that some of these drugs were given without prescription. I'm just saying what was told, not that the quality of the drug would matter, whether it's under prescription or not. But having said that, yes, there is a very strong element of nationalism, and I agree with Prashant that a lot of things in governance in India have suffered over the years. We have had this laid back attitude, but what has changed now is that, and there are some very real issues about drug regulation in India. First of all, the federal structure. Second, we don't have enough boots on the ground. We don't have enough funding. But what is a much more recent entrant into this debate is this element of nationalism, is this sort of this idea that India, because India is the pharmacy of the world is out to get us. So these allegations keep coming in, which to my mind is a little problematic, because all of us who have worked in this for some years, we are aware that there are genuine issues. Some of these are simply logistical issues. Boots on the ground is something that can't change overnight. But to just deny that all these issues exist and say that we are being targeted because there are business interests of MNCs. That I think is a little bit of a facile argument.
Okay, Gobardhan, I'll let you comment on whether you think actually India is unfairly being targeted. And you could also maybe explain then why is it not a rather simple ask to just have India, upgrade its regulatory laws that Prashant was referring to? I mean, from what we understand, there's a different regulatory law in basically every state in India. Wouldn't it just make more sense to unify the laws and have one national body to manage this?
Okay, you are asking me?
Yes, go ahead.
Yeah. See, I can let me respond the both of my fellow panelists. Mr. Prashant, he was talking about the Indian problem. Mr. Prashant, does he know that FDA this year itself recalled 64 drugs and the items for use? So this is not specific to India. It happens throughout the world. That it happened in Panama, it happened in Nigeria, it happened in the United States, it happens everywhere.
But those places are not considered the pharmacy to the world.
This is, and then in India, the Indian drugs, the 150 countries are still depending on the Indian drugs. And one incident with the DEG it should not make you that concerned. Yes, indeed. We have to make it more error-proof, and it has to go through the much more strict, safety measures. That I agree, but that doesn't mean that the Indian administration is doing all sorts of things and they are not taking care of it. And indeed, the Indian drugs has the highest standard, and it has been accepted globally.
Okay.
That is one thing.
Very quickly, Abantika, if you had a response, go ahead.
Yes. So I think one of the problems that India has is that we have a very poor reporting structure. So when something like this happens, FDA has a very set it has very set rules. There's a process of recall that is way more complicated in India. And I think Prashant can talk about that a bit because his book also deals with it.
Yeah.
That this very provision of recall is a problem because it's not there, or if it is there, it's very sparingly used. We don't hear of drug recalls. That is a problem. When something happens in a remote area in India, a lot of times those deaths are not even investigated properly. So we don't know actually whether the number of cases are limited to what we know or there are more cases.
Exactly. And I'm Prashant, we're not only looking at talking about deaths that are caused by these medications, but also people who have just gotten sicker because of taking potentially contaminated medications. And we're hearing what you've said in a prior writing from you, that this still hasn't stopped, that you're even hearing reports out of Yemen now that there were contaminated medicines. And the heart of this issue now is that, yes, these medicines, the world, so much of the world, I should say, depends on them because, especially in developing countries, this is the only affordable option people have. But it's not fair that they are substandard in these cases.
Absolutely. If I can just take off from the point that Abantika made, which is this issue of nationalism. So for the last, it's not just this government, even the previous government when there were scandals, the reflex reaction of the regulator and the ministry has been to blame the foreign hand or a conspiracy against India. And this is very, very worrying because what is at stake right now is not just the reputation of the Indian industry, that's secondary. What is at stake is also the health of Indian patients. If I can give you an example on this issue of recall that Abantika mentioned, this incident in Jammu, which happened in January 2020, where 12 children died of DEG poisoning, the regulator took it very lightly. They didn't do a proper investigation, and they didn't effect a national recall of all the drugs manufactured at that particular facility. So they basically recalled only one brand of cough syrup. 8 months later, a 2-year-old child is admitted to the same hospital where these 12 children died because she had consumed a different brand of cough syrup from the same manufacturer. So this is the problem when we lose perspective of these issues in the heat and light of nationalism. we end up compromising the health of our own people. I mean, it's not like Abantika and we don't want the Indian pharmaceutical industry to do well. We obviously want it to do well, but at what price? Not at the price of health of our own people and our fellow citizens in countries which import medicine from us.
Right. Prashant, very quickly, I mean, given how slow reform can be, if it happens at all, do you fear this will happen again?
Absolutely. This has already happened in Yemen. The World Health Organization has put out a product alert, and this is for a chemotherapeutic drug, the cancer drug, and they found some deadly strains of bacteria in the drug. This will keep happening in India unless the central government gets its act together.
Okay.
Because we can't have this system where each state has its own regulator. There's a single national law, but every state has its own regulator, and there's absolutely no transparency. Like, if the government wants to be transparent, they should publish the inspection reports.
Okay. Prashant, unfortunately, we're going to have to leave it there. I'd like to thank all three of my panelists really so much for being with us, and of course our viewers for tuning in as well. Remember, you can follow us on Twitter, and do be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We'll see you next time.